Hi, everyone. Good afternoon. How's everyone doing? Ready for the student session? So as a couple people will still be trickling in here, but we're just going to go ahead and get started for time's sakes. So welcome to the student session for Cal State Fullerton's ESG Public Health Symposium. We're all very excited to have you here. My name is Monica Avila, and I will be the moderator for this session. So just really quick, before getting started, I want to give a brief breakdown of how the session will flow. So in this student session, we will hear from 3 different presentations, each of which will last about 15 minutes or so. And after that, there will be a Q&A session for about 10 minutes at the end. So throughout all of the sessions or throughout the presentations, please feel free to place any questions in the chat so that we can get to them at the Q&A part. And so if anybody has any questions right now, please feel free to let me know before getting started. If not, we'll just jump right in. Alrighty, so our first presenter is Rienne Medina. Rienne is a second-year Master of Public Health student at Cal State Fullerton. She works at Pacific Private Practice Network and is interested in chronic epidemiology research and specifically in childhood obesity. Rienne, you have the floor.
All right, thank you, Monica. Let's see if I can share my screen with you all. All right, can everyone see the screen? All right, perfect. Okay. Hello, everyone. My name is Rienne Medina, and I will be presenting food insecurity and mental health among Cal State Fullerton students during the COVID-19 pandemic. Before I begin, I would like to acknowledge my faculty mentor and collaborators on this study. A little bit of background for you all. Stress is the psychological state that comes from demands of a person's social environment, while depression is the psychological state that comes with negative feelings that range from pessimism to an inability to work to suicidal tendencies. Before the pandemic, 14 to 59% of college students across the country experienced food insecurity. It was found that 31% of Cal State Fullerton students were food insecure at the beginning of the pandemic. Food insecurity can be detrimental to college students as it affects GPA, stress, and depression. A reported 44% of students with depression and anxiety symptoms were seen at the beginning of the COVID-19 pandemic in 2020. Since 2021, some researchers have found 57% of college students are food insecure. In other research, it has been seen that there's been an association between food insecure students, stress, and low grade averages. Universities had also increased outreach for mental health services and food assistance services, and Cal State Fullerton also was a part of this. During the COVID-19 pandemic, Cal State Fullerton increased awareness and outreach for many of their services, such as CAPS and Tuffy's basic needs services. Cal State Fullerton also provided emergency grants to students during this time to help relieve any struggles students may have had. Given this, I wanted to see if there was a relationship between food insecurity and poor mental health during the COVID-19 pandemic among Cal State Fullerton students. There were 2 waves of survey data. The survey known as the Pandemic Impact on Cal State Fullerton Student Survey was sent out to 20% of Cal State Fullerton students to participate, while also oversampling for Black students in June of 2020. The survey took 15 to 20 minutes to complete, and a total sample of almost 1,400 Cal State Fullerton students responded. In April 2021, a sample size of 384 completed the second wave. To encourage students to respond to the survey, there was an opportunity drawing for $50 gift cards in the first wave and $25 gift cards in the second wave. For my independent variable, I used the validated 10-item USDA scale to determine students' food insecurity status, known as the U.S. Adult Food Insecurity Survey module. Students were asked to complete this scale during both waves of the survey in June 2020 and April 2021. This scale measured from low food insecurity to high food security, and asked students if there was a change in dietary patterns from March to June 2020 in the first wave and January to April 2021 in the second wave. I use validated scales such as the PSS-10, the GAD-7, and PHQ-2 to measure mental health outcomes, stress, anxiety, and depression, respectively, for my dependent variables. These questions were part of the second wave survey in April 2021. For the stress and anxiety measures, the scales asked students their feelings within the last month, whereas the depression measure asked students their feelings within the last 2 weeks. The PSS-10 asked students about being angry over things out of their control, if they were able to cope with certain feelings, and their confidence in their personal life. The GAD-7 asked students if they ever experienced restlessness or having trouble relaxing within the last month. And the PHQ-2 asked students if they lost interest in doing things that they normally did within the last 2 weeks. I adjusted for age, race, ethnicity, parental status, monthly income, and transfer student status. The sample population consisted of 332 students. Descriptive statistics were conducted for the independent and dependent variables, as well as the covariates. chi-square tests were conducted to look at the association between food insecurity and the 3 mental health indicators. I also conducted logistic regression analyses to look at the association between food insecurity and the 3 mental health indicators while adjusting for the covariates. Here is a table of the student demographics. The mean age of the study was 27 years old. The majority of the students who participated in the study were Hispanic students at 47%, followed by Asians at about 21%, whites, those in the other category, and Black students. About 14% of students were parents, about 42% were transfer students, and about 43% of students had a monthly income of less than $1,200. Here's a graph of food insecure students in 2020 and 2021. In 2020, 31% of students were food insecure between March and June of 2020, while 18% stated that they were food insecure in spring of 2021. As you can see here, these charts show the percentages of poor mental health statuses of Cal State Fullerton students in 2021. The PSS determined high stress to be feelings of being overwhelmed or unable to cope with the demands of one's environment. And thus, with that definition, 50% of students stated to have high stress. If you remember, the GAD-7 determined anxiety to be fear or worry about the day-to-day. 14% of students reported to have anxiety symptoms. And with depression, it ranged from feelings of pessimism and suicidal tendencies, with 41% of students reporting to having depressive symptoms, all within the spring semester of 2021. Here you can see high stress in students and their food security status in 2020 and 2021. In 2021, students who reported being food insecure and having high stress was 3 times higher than those who were food secure. Here are the anxiety symptoms in students in their food security status in 2020 and 2021. In both 2020 and 2021, students who reported being food insecure and experiencing anxiety symptoms was 20% higher than their food secure counterparts. Lastly, are the percentage of students reporting depressive symptoms by food security status in 2020 and 2021. In 2020, there was about a 12% increase of those experiencing depressive symptoms and food insecure, while in 2021, there was about a 25% increase of students who were food insecure and experiencing depressive symptoms compared to their counterparts who were food secure. In bold are those odds ratios that are statistically significant. And so we can see here that even after adjusting for microvariates, age, parental status, transfer student status, race, ethnicity, and income, being food insecure at the beginning of the pandemic in 2020 was associated with increased odds of anxiety symptoms and depressive symptoms. Being food insecure a year into the pandemic in spring 2021 was associated with all 3 mental health indicators: high stress, anxiety symptoms, and depressive symptoms. As we can see, the odds of having poor mental health increase a year later into the pandemic for Cal State Fullerton students. A large percentage of Cal State Fullerton students had experienced poor mental health. About 50% of students experienced high stress a year into the pandemic, and it only increased once spring semester hit. Food insecurity was associated with poor mental health. This can be seen a year later with the possibility of a potential long-term impact from the pandemic. While more research is needed to understand the issue, one recommendation for universities is to make sure that students who are food insecure and were previously food insecure are aware of campus counseling and psychological services and are able to connect with them. Need to consider the long-term impact the pandemic might be having on students. Cal State Fullerton students were sampled through random sampling. This was a longitudinal study following up with students in the second wave to include multiple mental health indicators. But our findings might not be generalizable to other universities that address the basic needs services to their own student population. Here's a quick look at my references. And thank you all for your time.
Thank you, Rienne. Again, to our audience, if you have any questions for Rienne or any of our other presenters, please feel free to put them in the chat, or you can also wait for our 10-minute Q&A session at the end of our last presenter. So moving on, we have our next presenter is Sherryl Soukup. Sherryl is a senior at the California State University of Northridge, majoring in nutrition and dietetics. She previously completed an internship as a public health educator for a medical group. And in this role, she worked at locations throughout Southern California, including a family clinic in a low-income neighborhood, as well as a diabetes clinic. Sherryl, you have the floor.
Great, thank you so much. I will go ahead and share my screen here. Okay, can everyone see my screen? Okay, wonderful, thank you so much. Actually, I'm just gonna move the Zoom window. Okay, ready to go. Hello, my name is Sherryl Soukup. I'm a senior majoring in nutrition and dietetics at California State University Northridge, known as CSUN. I'm also the project lead for the Basic Needs Outreach Project. My presentation is on improving basic needs through student voices. Sorry, I apologize. I didn't realize the presentation wasn't in slide mode. Can you see the slides? Okay, great. Let me just go ahead and advance them then. Sorry about the technical difficulty. Okay, here we go. I look forward to sharing some awareness on important issues with you. The Basic Needs Outreach Project, which is currently in process, is part of a larger study aimed at improving educational success by increasing awareness of how Cal State Northridge faculty and staff can support students' basic needs, which include access to food, including healthy options and proper food storage, stable and safe housing, transportation, including ease of access to public transportation options, physical health care and mental health services, childcare and elder care, access to technology, such as a computer and Wi-Fi, and emotional support and social well-being, which includes a sense of belonging and being heard. In a 2021 survey, over 25% of CSUN faculty and staff reported that they do not feel sufficiently prepared to talk to students about their basic needs challenges, particularly regarding mental health and housing insecurity. This survey is part of my mentor, Dr. Duran's research, so she also happened to share the statistic in her presentation. Faculty and staff awareness and preparedness are so important in shaping these conversations, because when discussing these challenges with students who are experiencing a lack of access to these basic needs, it is crucial to avoid causing trauma or re-inflicting trauma in students who have previously experienced adverse childhood experiences, or ACEs. So a bit of background information: ACEs are potentially traumatic events that occur in childhood. Examples include, but are definitely not limited to, experiencing violence, neglect, or abuse, witnessing violence in the home or community, or having a family member attempt or die by suicide. According to the Centers for Disease Control and Prevention, scientists analyzed data from more than 144,000 adults and found that about 61% of them had at least one adverse childhood experience. Similarly, the Giano study of over 211,000 adults in 2020 found this rate to be 57.8% of adults. Both sources cite the incidence of adults who have had multiple adverse childhood experiences, with the Giano study noting 3 or more in 21.5% of adults, and the CDC publishing that nearly 16% of adults have had 4 or more. Women and several racial and ethnic minority groups are at greater risk for experiencing a higher number of ACEs, according to the CDC. And the Giano study found that multiracial individuals have significantly higher number of adverse childhood experiences than all other races and ethnicities. Nearly half of college students face challenges in meeting basic needs and access to resources, especially first generation and low income students. And the pandemic has certainly added further financial stress for many. Increasing awareness of these struggles reduces their impact on student retention and on degree completion, and it also promotes educational equity, particularly among underrepresented groups. As you can see, I have some additional pre-pandemic statistics to share on this slide. And I'd also like to acknowledge that we heard definitions for food and housing's insecurity in the earlier presentations. A 2017 report on a national study of basic needs insecurity in higher education notes that food insecurity rates range between 20 to 40%, with higher rates in California, and that national rates are as high as 50% for housing insecurity. Specifically for Cal State University campuses, a 2019 Basic Needs Initiative report issued by the Office of the Chancellor notes that 41.6% of students reported food insecurity. However, that rate goes up to 49% for first-generation college students. And while 10.9% of Cal State students surveyed reported being homeless, the prevalence for students who are both African American and first-generation college students was 18%, a rate higher than for any other group. The Energizing Basic Needs Outreach via Student Voices project uses the psychosocial-cultural framework and aims to develop and enhance programs which are proactive and responsive to student basic needs and security. Students collaborating on this project receive training in trauma-informed care and also in data collection and analysis prior to developing outreach strategies to connect with students. Team members will collect data representing students' voices concerning their basic needs through outreach activities. Now, let's take a closer look at how the team members go about that and what they learn in the process. As part of this project, student team members take part in various training activities as a team, in smaller groups, and individually. These activities may be assigned or self-initiated and include training in the following areas: social behavioral educational research, with team members receiving certificates of completion from the Collaborative Institutional Training Initiative program. They completed trauma-informed training through Leah's Pantry. Team members also attended a peer interviewing workshop and received mentor coaching after conducting a practice interview. There have been a number of valuable team learning activities, such as conducting literature reviews, reading a sample interview guide, and also a tip sheet for focus group facilitators, watching videos of student roundtable discussions, including virtual and live talks, talks with diverse groups of students, and roundtables covering various topics such as diversity, race, nationality, student debt, and also student concerns about virtual learning and other issues which arose at the start of the pandemic. The team has also studied how to lead tough conversations, encourage participation in group discussions, and to demonstrate sensitivity and to show empathy. Through the training activities in this project, students have acquired a number of valuable skills, including how to have constructive and meaningful team discussions, to learn through self-reflective journaling, to take initiative or help volunteer, advocate for change and to improve relations, to create an event flyer, to select a broad population, to compose and submit an abstract, and to write an interview guide for our upcoming roundtable talks. So this next slide shows images of some of the roundtable talks the team studied in preparation for conducting our own event next week. It includes diversity dialogues, a live Black History Month roundtable discussion, a Zoom virtual roundtable talk about experiences during the first week of virtual learning, and a TED Talk on how to lead tough conversations. Now I'd like to share what the next steps for the project are and what we expect to learn. We are holding 2 90-minute Zoom sessions next week. We will have a team of interviewers asking questions from the interview guide we have created and note takers to document the discussions. In an effort to pull a broad sample population of students from all majors, our event flyer was sent to all 54 departments at CSUN in the 8 colleges, which include Arts, Media and Communication, Business and Economics, Education, Engineering and Computer Science, Humanities, Science and Mathematics, Social and Behavioral Sciences, and also Health and Human Development. The note takers who collect the student stories shared at these talks will provide our team members with this qualitative data to compile and analyze so we can generate a report on our findings. Here's another flyer for our event next week. The team is very eager to meet with CSUN students and to hear their stories. It's important to note that other goals we have for this event include creating a safe, welcoming, and inclusive space for everyone to openly share their own unique perspectives. We understand the benefits of hearing stories from students from diverse backgrounds, and that sometimes the quietest among us have the most unique insights. We know that when everyone contributes, there are more ideas for all of us to think about, and everyone benefits from these new perspectives. Other goals of the live roundtable talks next week include learning to build on each other's ideas in a respectful and constructive manner, And we respect that every individual has their own truths based on personal experience. And that's why it's our job to work together to get closer to a collective truth. We've designed our interview guide using open-ended questions and clarifying questions to capture as much detail about the student stories as possible. Here are some sample questions from our interview guide. Have you at any point utilized on-campus resources provided by CSUN? If so, how did you hear about them? Has a professor or advisor recommended any specific methods of support? What qualities do you look for in a faculty or staff member that make them approachable or help to build trust? What are some policies your professors have had that supported you as a student? Have there been any classroom or campus policies which have added more stress? How can faculty and staff promote feelings of adequacy, competency, and autonomy, and of appreciation and belonging? In what ways have professors helped to motivate you academically? In analyzing the student stories captured, the project team will explore why someone accesses the resource, what makes a student feel supported, and how we can create a campus culture of care. The findings will be shared in peer-reviewed essays to inform training for faculty and staff members and will be used to create a profile for basic needs ambassadors. Pilot testing for ambassador training will take place during summer 2022, so we have some more exciting things coming up soon. So please stay tuned for the results. The project will also provide guidance on the best practices of basic needs ambassadors, including how to be more sensitive and compassionate advocates for students with prior oppressions or traumas. The recommendations based on the qualitative data collected will become integrated into curricula and activities which influence students at CSUN and hopefully at other campuses in the future. Next steps also include advocating for further advancement in basic needs programs and initiatives, such as the Basic Needs Suite Dr. Duran mentioned in her presentation. I would like to recognize the other Basic Needs Outreach Project team members, Amy Contreras, Cindy Crowell, Lindsay Frost, Stacy Frias, and Esther Arias, as well as my faculty advisor, Dr. Nalita Duran. And here are my references and image credits. Thank you so much for your time and for attending today's symposium on food insecurity. I look forward to answering any questions you may have in the Q&A session. Thank you.
Thank you, Sherryl. Just again, as a reminder, please feel free to put questions in the chat for any of our presenters. And we will move on to our next presenter. We have Jacqueline Beltran and Nicole Nukpese. Sherryl, would you mind the stop share, please? Thank you. So Jacqueline Beltran is a current MPH student in the fielding of School of Public Health with a focus on community health science. She does research on food insecurity, homelessness, and chronic disease. And Nicole has a Bachelor's of Arts in Sociology and an African-American Studies, and is a African-American Studies minor, an African-American Studies minor, and is an Associate Basic Needs Manager at UCLA's Community Programs Office. Thank you.
Thank you for the introduction. Hi, everyone. Good afternoon, and thank you for joining us. Again, my name is Nicole Nukpese, and I'm joined with Jacqueline, who will introduce herself again shortly. Today, our presentation is on identifying needs of staff experiencing food insecurity in higher education. But before we get started, we'd like to acknowledge our collaborators and partners throughout this research. We'd like to acknowledge the UCLA Jane B. Samuel Healthy Campus Initiative, who helped us gain funding for this this research. Without their efforts, such as the fundraising work done by Katie, Megan, and Dr. Wendy Slusser, our ability to have these food box programs in the fall 2020 would have been very limited. So thank you. We'd also like to acknowledge Dr. May Wang and her research team from the Fielding School of Public Health, the Community Programs Office, and lastly, our staff participants from our fall 2020 food box program. Now, we have an outline for our presentation, which we will start with an introduction, then we'll go into talking a little bit about food insecurity, the history of the Community Programs Office at UCLA, and its efforts during the pandemic. Then we'll talk about some methods and preliminary results, and then we'll conclude. So again, my name is Nicole. I'm the Associate Basic Needs Manager at the Community Programs Office. I graduated with a BA degree from UCLA. I'm from South Central and South Bay, but I currently reside in Maywood, California.
Hello, I'm Jacqueline Beltran. I received my Bachelor's of Science from the Pennsylvania State University in Kinesiology, and I am a current Master's of Public Health candidate, and I am an LA native.
Cool. So on to the next slide. What is food insecurity? Food insecurity is defined as not having access to enough food for an active and healthy lifestyle. It is associated with poor health and learning. Recent studies from the University of California have shown that 45% of undergraduate students and 25% of graduate students had experienced food insecurity. So throughout the presentation, we will be talking more about how this phenomenon is connected to our staff at UCLA. Now, the history of the Community Programs Office. CPO is UCLA's multicultural center here on campus. It offers a plethora of resources to our brewing community for over 50 years. Today, we will focus on CPO's basic needs efforts throughout the years. During the during the economic crisis of 2009, through collaborations between students and staff, UCLA was able to establish its first food pantry called the CPO Food Closet, which is the first pantry of its own throughout the UC system. This effort expanded to include other basic needs programming, but for the relevancy of our study, we will focus on the food box programs that provides intersession food assistance during fall, winter, and spring, and summer breaks. Now we'll talk a little bit about CPO's efforts during the pandemic. These images show the food box program distribution in fall 2020. So as you can see, there's some setup there. You see plenty of boxes there that are basically 50 pounds of food and produce in there as well. This was our first major campus event during COVID, especially when it was at its peak, pre-vaccination and pre-booster shots. So we had to go through a lot of planning on how we can manage the health and safety of this event, as well as how we can execute it. This event required a lot of volunteers and a lot of just manual labor. But despite that, all the other challenges we faced, we were able to provide these food boxes to not only our students, but our staff as well. So now, pre-pandemic, we offered a lot of resources to our staff members and on the low. So these staff members will visit our food closet to get free food. They'll get boxes during our food box distribution programs, and they'll also just send emails and requests for assistance. And so we wanted to kind of learn more and understand more about their staff's needs during the pandemic and how we can, partner with our research team from the Fielding School of Public Health to better assess and understand staff's needs regarding their basic needs. And so we wanted to also understand how staff demonstrated need during the pandemic. And so that's when we started this study that will focus on the food box giveaway efforts. and talk a little bit more about what kinds of impacts staff faced, whether it was from being unemployed, losing wages, having to supply and spend for expenditures, or take care of family, or kind of maneuver the remote working environment. These are some of the reasonings we found through our study that we'll talk a little bit more throughout the PowerPoint slide.
Thank you. Thank you for sharing the history of CPO. I think that's important to kind of acknowledge where exactly this has been coming from, and it's been an evolution. So just to kind of put into perspective of what we've been talking about, it's really to follow a more comprehensive understanding of the population. And we were able to do this through developing a questionnaire that was pre-tested for wording clarity. It was translated into Spanish, as we know that some of our participants prefer that language. And it was administered via online, given COVID-19 guidelines at the time. Recruitment and sample, as we stated, our participants are coming from those that participated in the food box giveaway that was conducted by CPO. The first email of getting our first batch of participants was actually distributed on February 23rd, and it was sent out to 627 staff who applied to the food boxes in fall 2020, and recruitment flyers have been posted in staff lunch breakout rooms. The survey is still underway, and there are reminders being sent out currently, text messages. To date, we only have 65 responses that have been received, so we'll only be presenting on the preliminary results thus far. But just to kind of highlight why exactly are we doing this study on staff, it's to help destigmatize food insecurity among staff at UCLA, and it's really to provide and collect data that can be instrumental for government institutions to create programs that are going to be constructed and created to help the population with a very comprehensive understanding of what their needs are and what are the gaps that we hopefully will fill through this survey. So essentially then provide them with policy recommendations or programs that are created that are going to be more effective than the ones that currently we have. Okay. So the questionnaire, for the purposes of this presentation, I'll only be sharing what I will be presenting on. This is not limited to what I'm sharing right now, but we took sociodemographic information, employment status. We utilize the USDA 6-item food security survey module, and that's already been validated. Specifically, we used 2 out of the 3 questions, and then we created one our own. And then we also took information regarding CalFresh knowledge and enrollment. That was something that was not previously asked through the CPO survey regarding the food boxes, which wasn't really necessary at the time, but we also want to have an understanding of that. So for our preliminary results, we have that from the time that they were receiving the survey, they had a 53.3% of our participants have a college degree or higher. And then following that, they have some college or associate degree. For combined household income of everybody that they stated that lived in their households, we see that 33.8% of participants stated that they make between 25K to 49K a year. And then following that, we noticed that 24.6% of the population of the participants stated they make between 50 to 69K. And this is household income, for 2019. This is what they were reporting on. And then this is how much they spend each month on their mortgage. This is relating to when they received the survey. So we see that 32 of our participants that responded to this question pay $1,001 to $2,000 for their mortgage. And then following that, 23 of the participants who responded $2,001 to $3,000 that are spent on their mortgage. So kind of just putting into perspective that if the majority is making 25 to 49K and they're spending around $2,000 to $3,000 on mortgage, that really leaves little for extra basic needs that they might of survival, to put in other words. So regarding food security, we asked, the food we bought did not last and we did not have enough money to get more. And the numbers will slightly vary because they were not all required to answer questions. And this is pre-pandemic on our left and during the pandemic on our right. So just kind of putting into perspective, we see the sometimes true prior to the pandemic was 44.6. And then during the pandemic, that number came to 39.1. But the differences here is noted is made up by the often true. So prior to the pandemic, it was 21.5% of our participants, but it did increase to 34.4%. So we're noticing that, yes, sometimes true might have gone down during the pandemic, but our often true did increase. And we could not afford to eat balanced meals. So prior to the pandemic, we have 45.3% of our participants saying that was sometimes true. And then following the pandemic, we have that number go up to 52.3. And again, we see a little bit of a distinction here with the often true, with 23.4% of participants stating that, and then 29.2% stating that and often true during the pandemic. We were worried our food would run out before we got money. We have here sometimes true prior to the pandemic, 41.5% saying that was true. And then after the pandemic, 43.8% saying that was sometimes true. It increased slightly. And then the often true prior to the pandemic was 27.7% of participants. And then often true increasing to 35.9% during the pandemic. For those we inquired if they had ever been enrolled in CalFresh, and these are the number of participants who responded, and those that are currently enrolled in CalFresh. So we see that the majority have never been enrolled and they're not currently enrolled. And what we're noticing is from those that said yes, that was, I'm sorry, I'm missing my numbers. Oh, sorry. It's 25.9, and that number decreases to 21.4 that are currently enrolled right now. And some of the reasons that we asked a question relating to why they had not applied to CalFresh. It's not presented here. I don't have it in my slides, but 84% of the participants said that they don't think that they're eligible. And then 10% stated that they didn't want to be in a government program. So just kind of putting that into perspective. And we are hoping to gather more information regarding that. But since March 2020, if your household has experienced any financial crisis, including but not limited to the bankruptcy, or more than ones have been unable to pay their bills, their rent, or their mortgage, with 58.5% saying yes, they have experienced a financial crisis since March 2020. So this is just a little bit of a sneak peek of our preliminary results. Following this, we'll continue to analyze our quantitative data as it comes in, and we hope to provide a more depth understanding of what the quantitative data is presenting by conducting focus groups of staff members. And we'd like to disseminate our findings with the UC Staff Food Insecurity Work Group, with other campuses and campus administrators and higher education audiences, and obviously through peer-reviewed journals, articles, and conferences. But one reason that I wanted to mention why we decided to focus on staff specifically right now, we will focus on students later, is because we're starting to notice a trend that students want to feel part of a community, and they're starting to question if academic institutions are holding up the values that align with the students, such as equity. And while we're not doing any direct advocacy work, we are providing our data and our findings to government officials that requested, so that they may create more comprehensive and effective programs and policies that will help mitigate food insecurity, healthcare, negative healthcare outcomes. Well, thank you for listening, and I'm excited to share any questions or answer any questions you may have.
Thank you all.
Thank you, Nicole. So now we're going to jump into our Q&A session. Again, it'll be approximately 10 minutes before ending today's student session. I didn't see any questions in the chat. Feel free to unmute yourself if you want to ask any of the presenters any questions.
I do have one question for, I hope I pronounce this correctly, Rienne, is that right? Rienne?
Rienne, yes.
Rienne. Great presentation, by the way. Actually, everyone's presentation was wonderful. Thank you. But I had a question about the amount of participants dropped between your first wave and your second wave. And I was curious to know that, I noticed in your second wave, you said you added those 3 additional scales. Did you notice any change in the survey behavior by adding those 3 surveys? For example, did you find that maybe students got through the food security scale, but then when they we're completing the additional scales, did you see the completion rate reduced?
So the reason why there was a reduction from the first wave to the second wave in participants was because we only followed up with the students who said it was okay to ask them to if we can send out another survey in the next couple months. That's why I went from about 1,400 to 384. And I only noticed in a couple of participants that it did drop off a little bit, getting towards the end of the survey, where not all of the mental health questions were 100% completed. So we had to drop those numbers off, drop those participants off, yes.
Great, thank you.
Mhm.
I know we have a lot of students among the audience today. So I have a question for all the presenters. How did you get involved in this research? And do you have any advice for undergraduate students who are just starting and want to do similar work or research?
I can start us off. I think in undergrad, I started to really become interested in how research actually was executed. And one thing that I would advise students that are starting to become interested is find something you're passionate about, and then look within your own community of whatever university or institution you're at, and see what faculty is doing the work that you're interested about, and then do an informational interview. And then from there, ask if there's any potential opportunities that they may have or that you might be a good fit for. And you'd be surprised how many faculty and academics are willing to share their own network with you if you are proactive about what you want.
I agree, Jacqueline. I'm actually speaking to everyone today as an undergrad, and I'm a little bit of I'm going to say a research nerd, and that I came back to continue my education, but in my career prior to doing that, it involved a lot of research. And so while I might naturally gravitate towards that, the advice I would have is really try to align yourself with, as Jacqueline mentioned, whichever professor's work you're drawn to, what you seem passionate about. Sometimes there might be a student organization that has a cause that you can help promote and get more involved in. There are certain classes that will advertise internship opportunities, and those may involve research. So there's just keep your eyes open, because there are opportunities out there, and find ones that align with your interests. Thank you.
I'll chime in. I think for me, I grew up in a lot of underserved communities. And so I myself have experienced a lot of challenges that current students and staff go through. And I personally benefit from the resources and services provided by a lot of our campus partners and our institutions. So I think for me, like, it's important for those who have experienced the need to also be those advocates and be those leading that research and that change. And that would be the advice that I give to students who are interested in this work, to, don't be scared, to definitely go for it, and just be willing to look out for others and help others.
I 100% agree. I didn't get into research until my senior year of undergrad, and all I have to say is email, talk to your professors. They're not scary. I promise. They want to be there for you, and they will help you every step of the way.
Great advice. Thank you so much. Anybody else have a question? If not, I will jump in with another question that I have. Alrighty, so I know in research there's bound to be some challenges or limitations. So what challenges did you experience in conducting this work, or anything that surprised you, or anything surprising that you learned?
I'll jump in. This is really, oh, sorry, Rienne, I just noticed. This is pretty basic, but we take it for granted that everybody's got busy schedules and busy lives, and trying to align time with your team members to work on things for the project to move it forward can be really challenging. And the distance learning that we've done during the pandemic has made that even more challenging to try to align our schedules. So that was the first one that came to mind for me. Rienne, please.
Yeah, I think just going back to Dr. Duran's question of like, why is there a drop in participants? I think that was the hardest part, is some students just don't want to participate again, and it's a little bit of a letdown, but you just gotta push through and work with the numbers that you have. And it was just surprising how many students had high stress, about 50% for my study. And so I thought it would be lower, but I guess we need more resources for students on our campus.
I think one thing that I might add to this is that I was really pleasantly surprised how effective we've been able to adapt to COVID-19. We've been doing all this work since now coming up on almost 2 years, or a full year almost, a little bit over. And we have not once our team met in person. We've all been working via Zoom spaces, and we've been extremely effective. And I'm surprised at how you can still do a lot, even if you're not physically in the same location as your other colleagues.
That's amazing. Thank you all for doing such important research. And I know everyone here, as well as myself, is grateful for hearing what you are doing in these communities and within your institutions. And with this, this concludes our CSUF ESG Public Health Symposium on Food Insecurity. We want to thank all our presenters and our audience for joining us. We really appreciate your time, and we hope you have a great rest of your day.